Hello, everyone. My name is Kenneth Tong. My pronouns are he, him, they. I currently practice as a mental health counselor with Children's Service Center Robinson Counseling Center. We are a nonprofit, community-based service agency that provides a multitude of different mental health services, drug and alcohol services, as well as primary care and medication management. Currently through Evergreen, I am a certified clinical trauma practitioner. I also have my certified mindfulness informed professional certification and recently just got my certification in DBT counseling. So for me personally, working in community mental health, you are essentially treating anything and everything. For my specialties, I focus a lot on complex PTSD. I'm also a individual who specializes in gender and sexuality-based therapy. So with the gender and sexuality pieces and the trauma pieces, it was really more so what makes sense for me, what's worked for me when it came to my personal journey with gender and sexuality and my personal journey when it comes to trauma, and how can I integrate that into my own practice. And that's kind of where I leaned more on like the trauma certification and the mindfulness, because there's just something that just gravitated me towards the concept of doing trauma-based work with a mindful kind of like framework in mind. It wasn't until after I graduated from my grad program and started working as an outpatient therapist, that's when I really got introduced into dialectic behavioral therapy, DBT. My one supervisor has many, many years of practicing DBT. And we also had the opportunity to do the training through PESI, the 3-day dialectical training. And ever since I learned about Linehan's model of mindfulness, but incorporating mindfulness with distress tolerance, emotional regulating, and interpersonal effectiveness, everything just kind of clicked for me at that point. And it was just like, it just speaks so much to me that I need to like show I can do this. Do my introductions to my clients, especially when they're first meeting me, it gives them a sense of confidence, sense of confidence, but also a sense of relief. I've been practicing mental health for 11 years now. Over those years, it's a combination of, community-based work, a lot of different therapeutic models, and just doing a multitude of different things. But even with the 11 years that I've been in the field, it was important for me to find and kind of like hone in on what made sense. And just by saying like, hey, I've been practicing for this long, but I also got certified, it just kind of gives them a sense of reassurance that, yes, I'm your therapist. Yes, I'm a good expert in this. But I also take the approach of, just because I have the certification doesn't necessarily mean that this model is going to be the best for you. I'm still treating you as you, just helping you see it from a mindful perspective, maybe from a DBT perspective. The one thing I love about my DBT certification is I tell my clients, you're already doing the skills. I'm just teaching you and giving you a new way to look at it. And every time I do that, there's just something that clicks. When I talk to them about my trauma certification, the mindfulness certification, it gives them a sense of empathy, because not only do I share what it means to be someone who has trauma, but I understand the living aspects of the symptomology of trauma, the after effects of trauma. And it just helps them understand that they're not alone. I think the one thing I learned is I'm good at what I do. I think what shocked me the most when I was doing the Evergreen trainings were, you know, the experience that I went through and the way each of the different presenters and speakers talked about their topics. It just connected for me. There was some kind of like empathetic resonance when they were talking, and I could immediately apply it to what I'm already doing in my profession, what I have done in my profession, what I'm going to potentially be doing in my profession. It really opened my eyes to broadening my sense of how to be a better clinician and how to treat my clients. I totally would recommend certifications through Evergreen. I found the process to be very easy, very like streamlined. Even when I talked to customer service and had questions, they were always very courteous, very informative, and overall just a good sense of support. Like it wasn't like, oh, you need to do X, Y, and Z. Like they actually took the extra step with me to be like, okay, what are your barriers? How can we help you through our side to help you attain this certification?